Hi, this is Phyllis Greenberger. I'm a lead advocate at Disability Rights Wisconsin. I'm going to talk to you about some of our PAMI priorities for our advocacy on youth justice. First of all, I'm going to talk about some individual cases and things we do in that area, and then I'm going to talk about some systems or policy issues. For individual cases, one area that we work on individual cases is youth who are involved in the justice system and need access to mental health services. This can include youth that are in institutions, youth that are in the community, youth that are in detention centers, residential treatment centers, etc., who have been adjudicated delinquent by a court system. We have advocated for a variety of things, such as medications for as a psychiatrist who can provide medications for the youth, or for the youth to have a therapist, for participation in some community programs such as Comprehensive Community Services or CCS, and other wraparound programs like Wraparound Milwaukee or wraparound programs in other counties, and for appropriate mental health services so that youth can access other programming that might be available to them. Another area that we've done individual advocacy in is for individuals where there's an excessive use of isolation or room confinement or restraints. We have worked on that issue in a variety of places, detention centers, hospital-like settings, as well as DOC facilities. We have worked with youth and their parents, sometimes also with an assigned county social worker, to address areas that relate to isolation, seclusion, or restraint in these facilities. We've worked with facilities on behalf of individual youth on this issue as well. You will hear a little bit more about this in our systems work, as this has led us to address this issue systemically also. Another area that DRW does some individual advocacy in the youth justice area is education. For some youth who have an IEP or an individual education plan, we have attended IEP meetings for youth that are involved in the justice system. We've worked on behavior support plans for youth in the justice system. We've helped in terms of education and getting counseling or other mental health supports in schools for youth that are involved in the justice system. We also provide information to parents to support them in being advocates for their children. In addition to some of the areas where we have been advocates in individual cases, we also work on the youth justice area and mental health within youth justice through some systems or policy work that we do at Disability Rights Wisconsin. One of the areas that I mentioned earlier in individual advocacy that we have been working on in a systems advocacy kind of way is isolation, room confinement, or restraints. DRW has worked on the reduction of those in youth justice in general. Most recently, we've been working with a particular facility on some issues that they have been having and that we're concerned about with youth room confinement. We have also sometimes sought out experts nationally and tried to get some more information to help us advocate on these policy issues within Wisconsin. Another area where we have done some policy or systems advocacy was around the closing of Lincoln Hills and advocating for more community-based, smaller residential types of facilities when someone needs to be in a residential facility rather than at a larger, far away from home DOC facility. In addition to working on the closing of Lincoln Hills, we've worked on policy issues that relate to that and how new places and or community program can take the place of the Department of Corrections facility. We've also met with the Secretary at Department of Corrections as well as Department of Children and Families to work on issues that are related to youth justice that those two departments work on. Another area of systems advocacy we have done some work on is something called Raise the Age, which is helping to change the law in Wisconsin so that 17-year-olds will no longer be treated as adults for criminal prosecution, but will be back in the youth justice system. The last thing I'm going to mention in the youth justice area is that we've worked on a variety of issues that are in the budget on increasing supports for youth who are in the justice system.